Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended the extremely narrow ear canal entrance and they had occluding earwax. And as you can see, the ear canal is so narrow that the suction tube, so the Zollner suction tube, which is a standard size, just about fits. And in order for it to fit, I'm stretching the ear open with the endoscope. So what I'm doing here, I'm pulling the ear back and up, and what that does, it widens and dilates and straightens the ear canal. And to keep the ear canal ajar, keep it open, I'm using the side of the endoscope to, almost like a doorstop, I'm pushing the ear canal to the right to keep it stretched open, at the same time making sure the endoscope is visualizing towards the wax, which then enables me to also put the sucker into the ear and stretch the ear canal further to the right, and then before going in and down. So it's quite a complex case for that reason. And it's really, I was quite shocked actually by how much wax came out of this gentleman's ears. It was given it was so narrow, and there's an incredible amount of wax. Now, the entrance was a lot more narrower than the ear canal near the eardrum. So as the ear canal was more medially positioned, the ear canal did widen. And the wax was also very stubborn. It was very crusted. I had to use drops on several occasions. I had to use the forceps, but we did manage to finally get it out. You can see there's hardly any room for manoeuvre with the sucker in there. And I'm just trying to lift this up and out. You can see I'm getting this bit slowly out. Now what was interesting, I actually started off the procedure using the wax scope with a speculum, but I soon reverted back to the endoscope. It's just because, contrary to belief, myth, I feel an endoscope's a lot better for narrow ears than any other technique, including an ENT microscope or even the wax scope. It's always been believed that when you have a speculum, that when the ear canal is really, really narrow, you can widen it, but it was so narrow that even the speculum wouldn't go through. So in these really, really extreme cases, this is clear evidence that an endoscope is, once you've mastered the technique, of course, is far superior, in my opinion, than any other technique. And historically, it's always been said that an endoscope isn't suitable for narrow ears because you've got two instruments and it's going to take up space in the ear. But you can see the technique we're using. We're more than able to, even in a very narrow ear canal, able to use both the endoscope and the sucker. And in fact, as I said, I found it a lot easier performing this procedure with the iClearScope endoscope. So you can see how the ear canal widens there, and once I've removed this plug, you'll see it's very deep in the ear canal, near the eardrum. There's another narrowing, and the wax got stuck there. So I'm going to put some more drops in a moment, just to loosen this a bit further. You can see it extends all the way to the eardrum, and at the base there is a dip there, a little widening at the floor of the ear canal. And initially when I was bringing this wax plug out, you may have saw that I was trying to lift it from the base and lift it up and out of that ditch. So although I've got a half decent suction grip, I'm trying to manipulate this out, but you can see it's adhered very deep in the ear and it doesn't want to let go of itself. So what I'm doing now, I'm just wriggling the wax, just trying to loosen it. I think in a moment I'm going to use some forceps. There we are. Even the forceps were really difficult to get in. I couldn't really widen the jaws any more than I was now. And I did manage to pinch the tip of it just here. And I was hopeful it'll come away, but as I got where that narrowing is, it just peeled apart the wax and it's not able to get another grip there. But I did go back in a moment, you will see that, and I was able to get a better grip with the forceps, and I did remove a big clunk of wax out there. So for now I'm just resorting back to the suction probe. I'm just trying to loosen this really, so I'm going up, down, left and right. Little wriggle motions just to try to detach it and mobilise it. So it is moving slightly. This patient has a history of wax impaction, as you can imagine, because of their ear anatomy, and they found that in the past they've had to make several visits to whoever they used to see before to remove the wax. There we are. So I managed to get the forceps, both the jaws at 3 and 9 o'clock, and trying to get around it. You can see there's still loads more, and I was quite surprised actually. So once again, just widening the ear. It's coming out slightly easier, but there is a bit more of a challenging plug in a moment. And once we bring it to this part of the ear canal, then it's just a case of wriggling it out because it's larger than the entrance. So you can get narrow ears for different reasons. It could be congenital, so they were born with a narrow ear. It could be due to chronic ear infection and repeated ear infection, and then you get scar tissue buildup and a weakening of the ear canal, so it kind of collapses, and we call that, or a swelling of the bone, the bony part, and we call that stenosis. You can also get a collapsed canal with age, and that's more to do with the cartilaginous portion, the outer third, where the cartilage weakens and it kind of falls upon itself and it causes a narrowing. So I've managed to squeeze a bit deeper into the ear. You can see the endoscope now. I'm at the juncture where it's really narrow, just to see the deeper wax. So there's a few hairs there in the way, so there's not much we can do about that. And it wasn't really obscuring the view. So in some extreme cases, I have been known to pluck these hairs out, but I said it wasn't really it's not really affecting me too much. So again, just using the endoscope to stretch open the ear, going in with the sucking out, and I'm just going I'm crawling forwards then with the endoscope. So you can see we've got a much better view now, even though it's a very narrow ear. And I'm just going up and down, just to loosen this. And slowly but surely it's coming away. So you can see there, the eardrum's in the distance. It's very hard to even visualise the eardrum, especially the anterior portion, so the front part of the eardrum, which is, in the case of the left ear, is on the left-hand side, and that's because the ear canal, the bony part of the ear canal narrows and widens again. And you can see they've got like a widening in the mid-canal here. Then you go further in, so it narrows, it widens, and it narrows again, and it widens. And that can make the procedure quite tricky. You've got this skin that's failed to migrate, so I'm just using a fine-end sucker now just to peel this away. I think there was some clarinetting, so we couldn't get all of it out, but I just advise the patient to use some olive oil spray on a regular basis. Maybe it's a good time to reveal something. I can't say it fully at the moment, but going to be some exciting developments in terms of some ear care products that I'm working with a company with, and I'm going to announce that soon and launch them soon. They're going to be available both to the general public in the UK and also for bigger trade companies, other audiologists who wish to supply their customers and their clients and patients with it. So all will be revealed very shortly. I'm very excited with the products that's been developed and that's on the market, that are going to be on the market. So yeah, we've just advised the patient to use some olive oil spray on a regular basis, just to, especially in the left side. So this is the right ear, so we swapped over. So it was blocked, but it was far easier to remove. It's a lot softer than this side. And although the ear was narrow, it wasn't as narrow as the patient's other ear. So you can see the eardrum there. It's just a bit of, it's a bit more matted wax and skin here. So I'm just going to, this is at the base, I'm just going to peel this away. And what the drops will do is just help soften the wax. Sometimes if you use spray olive oil drops on a regular basis, you soak your in and you tilt it back the other way to drain it out. For some people, it can wash away any wax before it forms into big plugs if you do it on a regular basis. But in cases like this patient's left ear, it can soften the wax. So although it doesn't remove it, it's far easier to remove professionally when the patient attempts, because it was quite complex, that left ear. And especially people with dry ears, so as we get older, we can all suffer from dry ears, and when women are going through menopause as well, that they can get dry ears, so it helps to moisturise the skin. I hope you enjoyed that video, guys. Have a great weekend, take care, and remember, be nice and be kind. Thank you.